Etiology of the gastric carcinoma. In addition to the chronic infection of H. pylori, there are certain other factors, though they are not related directly, but they coexist or they are the provocating or aggravating factors, risk factors. Number one is tobacco smoking. It is confirmed that smoke of the tobacco consists of hundreds of injurious carcinogenic chemicals which are responsible for production of carcinoma in lungs, stomach, and especially the bladder, human bladder carcinoma. These carcinogenic chemicals present in the tobacco smoke, they are responsible for these carcinogenic changes. In addition, excess amount of alcohol, caffeine, spicy and salted food, and the various products which are rich in saturated fat, red meat, these may cause the provocating or the stimulating or triggering factor for the production of gastric carcinoma. They are the trigger factors. Now the symptoms of the gastric carcinoma is nausea, vomiting, epigastric discomfort, bloatedness, belching, hematemesis, melena, early satiety, loss of appetite, loss of weight, anemia, jaundice, ascites, dyspepsia, dysphagia, and according to the organs suffered by the secondary carcinoma of the gastric or the stomach carcinoma. That is, if the secondaries are deposited or attack the lung parenchyma, that produces painful cough, dyspnea, restlessness, breathlessness, pleural effusion. Similarly, if the secondaries settle in liver tissue, produces jaundice, enlargement of the liver, hepatitis. If they settle in or attack the gallbladder, there is called cystitis, pain in the lower hypochondrium. Similarly, where the secondaries are produced, they produce accordingly the symptoms. Now the diagnosis of the gastric carcinoma. Blood complete picture for detection of the H. pylori antibodies, HB concentration, RBC count, because we have to calculate due to loss by the melena or the hematemesis. Next is the stool test for melena and also the H. pylori bacteria presence. Now, abdominal ultrasonography, in which sound waves are used to produce the scan over the monitor. It is an external device as well as it is passed through the endoscope directly into the stomach and get the clear view of the anterior of the stomach where the cancer is located to examine the size, type of the carcinoma. X-ray series of barium meal swallow, intake of the barium in the liquid form, and then series of X-rays are taken to detect the location, extent, and the size of the carcinoma in the stomach. Now the main diagnostic device is endoscopy, that is the upper endoscopy or gastroscopy. It is a flexible tube passed through the throat via esophagus into the stomach, fitted with light and video camera. The examiner or the doctor can visualize and observe the anterior of the stomach, the various locations of the carcinoma. Moreover, the tissue that can be extracted for laboratory examination, histological examination under microscope. This process is called as biopsy. This device, endoscope, is also used for gastric resection when the cancer is in small size, limited one, that can be excised through this device, endoscope device. So these are the various diagnostic tests and symptoms related with the gastric carcinoma.